Common Dreams has a great story here about New York, which of course is my state. Single-payer success in New York as Medicare for All bill passes state assembly. The New York State Assembly is leading the way with the only kind of healthcare bill that will put people before profits. So here's what they say. The New York Health Act would afford all state residents access to comprehensive inpatient and outpatient care, primary and preventative care, prescription drugs, behavioral health services, laboratory testing, and rehabilitative care, as well as dental, vision, and hearing coverage. Wow. There would be no premiums, deductibles, or copays. The plan would be funded through progressively raised taxes, including a surcharge that would be split 80-20 between employers and employees. As Salon's Amanda Marcotte wrote earlier this month, the legislation's lead sponsor, Assemblyman Richard Gottfried, says almost all New Yorkers would pay less than they currently do because they would be able to replace their current plans with this more affordable state-based plan. Furthermore, Marcotte reported, Gerald Friedman, an economics professor at the University of Massachusetts Amherst, agreed. In 2015, he wrote an analysis of the proposed bill, and he concluded that a single-payer system would save money across the board by reducing healthcare spending. One advantage is that a single-payer plan will allow providers to economize on the cost of handling the billing and insurance-related expenses, Friedman argued. Previous incarnations of the bill have passed the lower chamber multiple times, only to not be picked up for consideration by the state Senate. This time, it could be different. Now, they say that because they're only 2 votes short of it passing, and apparently there's a few elections or special elections that are going to happen where the person who's the overwhelming favorite is in favor of the bill. So, it might happen soon, dog. I mean, New York passed, albeit a flawed bill, but it's a free college bill. 4-year free college bill. And they might lead the way on single payer here as well. I know California is very close as well. National Nurses United doing a fantastic job there. I think it's great. I think it's great. And by the way, I would immediately, stop buying the shitty private insurance I have. I've explained to you guys my problem. One time I had the bill on auto pay, they didn't fucking deduct it at the right time, and I lost the insurance, there was a lapse in the insurance. I'm like, what happened if I had a heart attack or some shit in this gap? What then? Up, you go bankrupt, what are you gonna do? What the fuck is that? And through no fault of my own, it's on fucking auto pay. It's supposed to deduct every time on that date, and it didn't, whoops, insurance gone. What is this bullshit? And then I love pay me every month, and then when something happens, it's cool, but you got to cover the first, $5 grand. Then why the fuck am I paying you? What is this? So it's just, I'm so tired of the rapacious for-profit private health insurance middlemen. They're sharks. I don't need them. Why do I need you? I pay you to maybe cover me when something happens. No, we should have a single-payer healthcare system. It comes directly out of your taxes. It's such a no-brainer, man. And they said, no deductibles, no copays, no premiums, no nothing. Taxes raised a little bit on the wealthiest, and boom, everybody gets their coverage. You can't beat it. Now, here's the only potential downside. We saw this happen in, I think it was Vermont. Vermont passed a single-payer system, and there was so much pressure from big pharma and the private health insurance companies and the medical companies that they buckled. The governor and they were just, never mind, we're not doing this. What do you mean? We can't do it, because my guess is the big companies that have a stranglehold all across the country and on the federal government, they said, look, if you do that, we'll just jack up your prices. We'll just make you pay double, triple what other people pay for medicine. We'll make you pay more for, whatever, everything. So we're just not going to let you do it. We're just going to prevent you from doing it. So you could run into that roadblock as well. But if California goes and New York goes, I mean, those are powerhouse states economically. I mean, if they go and it's successful, it's a matter of time until all the blue states get it done. I'm in favor of 2 different ways of doing it. You could, at a federal level, either say we're going to do a national health insurance system, Medicare for All system, or what you could do is you could mandate by law that each individual state sets up their own single-payer healthcare system. So you have 50 smaller single-payer systems as opposed to one large single-payer system. I'm fine with either one of those. So they often talk about bipartisanship and negotiation. There's a compromise that progressives can be fine with because you're still getting a single-payer system. So, they say, well, no, we needed to compromise down to a public option, and then from the public option to Mitt Romney's plan, an individual mandate plan, which keeps the for-profit private health insurance companies in control. No, that's a compromise I am not in favor of. What I am in favor of is, okay, you don't want to do a giant national single-payer system? Fine. Let's have a law that says each individual state has to set up their own single-payer system. That would be fine by me. That's a compromise I could get behind. I'm in favor of either one. But New York is having some initiative here along with California, and hopefully it really passes in one state or the other or both, and then it's a domino effect.